this is Angelia, and you are listening to or watching the podcast, Why You Do What You Do. The podcast that talks about human development and psychology to maybe help you figure out a little bit more about why you do what you do. And we had left off on patterns of grieving, and we're going to pick back up on that. First, depression is far from universal. Some people just don't get depressed by someone's death. Especially if the death has been coming on for a long time. They may have already come to acceptance with the death, and so they don't get depressed. From 3 weeks to 2 years after their loss, only 15 to 35% of widowers, and victims of spinal cord injury showed signs of depression. So, most people, it sounds crude, but do get over, and it lessens with time the emotional impact that a loss causes. Second, failure to show distress at the outset does not necessarily lead to problems. The people who were most upset immediately after a loss or injury were likely to be more troubled up to 2 years later. So your mindset comes into play. If you're naturally an anxious, depressed type person, then you're more likely to stay anxious and depressed about this. If you're more of a resilient person and or the type of person who keeps moving forward and, takes their downtime, but then gets up and moves on, then that's how you're going to deal with that loss as well. Third, not everyone needs to work through a loss or will benefit from doing so. I've had well-meaning people say, oh, well, you need to talk about that. It's like, I'm really not in a place anymore where I feel like I need to talk about that or deal with that. That was then, that's all over and done with for me. So, people mean well, but they don't know everything about you. They don't live in your head and in your heart. So, sometimes they want you to rehash stuff that's already back there, and it really just brings it back forward for you. So, if someone says they're fine now, they might not really be, but then they might really be. So, take a cue from them on whether they want to talk about this with you or not. Some of the people who did the most intense grief work had more problems later. And that could be because they're dwellers. There are people who constantly dwell. They just can't let anything go. They just constantly dwell on things. And those people are going to have more of a problem adjusting to life because life's going to happen. And if you just keep dwelling, you just keep bringing that back up for yourself, it's going to be harder on you emotionally and mentally. Fourth, not everyone returns to normal quickly. So, like I say, there are people who it takes them a long time to grieve. I'm still grieving my grandma. I miss my grandma terribly. She was like the person who loved me most in the world, I do believe. And I wish still to the day that she was here and I could tell her about stuff and ask her about stuff and talk to her about stuff, and there are other people in my family that I really miss and I wish they were here now, So some deaths take longer to get over. It depends on how you are as a person and how close your relationship with the other person was. More than 40% of widows and widowers show moderate to severe anxiety up to 4 years after the spouse's death. So that's not quite half, but that's still a pretty high number, especially if it was sudden. And again, when a death is slow, when there's a lead up to the death, you have more time to adjust to the idea that you're going to lose your loved one. If the death is sudden, you had no preparation. That's kind of, my mom's was kind of like that. She did have a heart attack a few months before, but she had gotten better, She went from not even being able to put her own clothes on to, going out shopping again. So we thought, okay, well, she's good. And then she dropped one morning. So, that was kind of sudden. And then my little sister was killed in a car accident. That was very sudden. So we had 2 weeks to get used to the idea, but, like I said, I was just sure it wasn't going to happen, but it did. So, if you have time to prepare, it's easier on you than if it happens quickly. Fifth, people cannot always resolve their grief and accept their loss. And there are people like that. We know Queen Victoria wore her mourning clothes till the day she died after she lost her husband. And there are folks like that. They, their life partner is their partner, or they have such an attachment to the person who has passed away that they will never be right about it again. And, that's just a fact of life, because, like I say, everybody's different. Everybody reacts to things differently, and everyone has a different level of resilience. Parents and spouses of people who die in car accidents often have painful memories of the loved one, even after many years. And I know that, I did about my sister, and I know my mom, went to a grief support group. So, I mean, like I said, the more violent the death, the harder it is, for you to wrap your head around. Acceptance may be particularly difficult when a loss is ambiguous, as when a loved one is missing and pronounced dead. Now, I know people like that whose loved one was supposedly killed in a war. A girl I went to school with, her mom, got dog tags, but there was not a body. And he was in Vietnam. And so she was still holding on to the fact that he might be alive. He could be alive out there. I'm not going to, just accept that he's dead because they gave me some dog tags and not a body. So, she, to the point where I stopped, being friends with this person when we got out of school, her mother was convinced he might not be dead. He might still be out there. So when you don't have a body, it is harder to accept, because your mind is, like Missouri, the show me state, your mind wants to see, your mind wants to know for sure that this person is gone. Rather than a single 3-stage pattern, this research found 3 main patterns of grieving. So, everyone builds on each other's work in science, and psychology is no exception. Bleh, my tongue. But, so the first people started mapping this stuff, has led the way for other people to start building more things. In the generally expected pattern, the mourner goes from high to low distress. And again, that's not everybody. Everybody's different. Everybody has different levels of doing things. And some people think too much. They get in their head too much, and work up their anxiety. So they might not have as much stress in the beginning. And then they work their way up to the point where they do. In a second pattern, the mourner does not experience intense distress immediately or later. So some people, they are more resilient, more accepting, and they move on. In a third pattern, the mourner remains distressed for a long time. And like I said, that's for people who, I've known widows who say, my husband was my love. He was my partner, and there will be no one else for me. And that's just how they feel about it. The finding that grief takes varied forms and patterns has important implications for helping people deal with loss. So, like I said, one size doesn't fit all. So you can't treat everyone exactly the same. That's why a therapist is asking you a bunch of questions, because they're trying to figure out how you do things, how your mindset works, how your emotions work, to kind of know how to help you. It may be unnecessary and even harmful to urge or lead mourners to work through a loss, or to expect them to follow a set pattern of emotional reactions, just as it may be unnecessary and harmful to expect all dying patients to experience Kubler-Ross's stages. Because like I say, everybody's different, so you can't expect each and everything to be a cookie cutter thing. That's why I question some of these life coaches and social workers who do just that. They have their little cookie cutter outline that they think this is how everyone does this. But it's like, no. If you dig a little deeper into psychology and things, they teach you that, one of the first things they teach you is there's no such thing as normal. That there's a law of averages. The average person's here, and then there's folks to this side of it and this side of it. If someone comes up with set things for you, take that as a guideline, because like I say, everyone is different and everyone reacts differently. Everyone has a different level of resilience and acceptance. So no two people are going to be exactly the same in how they do anything. Respect for different ways of showing grief can help the bereaved deal with loss without making them feel that their reactions are abnormal. Because abnormal, again, if there's no such thing as normal, there's really no such thing as abnormal. It's the law of averages. And like I say, people fall to the left of that, people fall to the right of that. Excuse me. So, again, that's a term that in psychology you don't really like to use. Most bereaved people eventually are able, often with the help of family and friends, to come to terms with their loss and resume normal lives. And again, that's most people. There are people who grief knocks them on their butt and they never get back up. If you are a family and friend of someone who's lost someone, be there for them. Let them know you're going to be there for them. If they ever need anything, to let you know. And a lot of people say that. And then if you were to ask something, they would be like, oh, well, yeah. But there are people, and you know who those people are, who would be there for you. So, be a good family member, be a good friend to someone who has lost someone, because they might need that. For some, however, grief therapy, treatment to help the bereaved cope with their loss, is indicated. And like I say, those are the people who are having a hard time getting over with it. These are people who have a high anxiety level, are not resilient and adaptable, and then they can, benefit from some grief therapy. Professional grief therapists help survivors express sorrow, guilt, hostility, and anger. Because sometimes people are so used to repressing their emotions, they don't know what to do with them. An emotion comes up, but they don't know what to do with it because they're so used to repressing their emotions. They don't know how to manage them. And unfortunately, people are taught that when they're younger sometimes, to repress those. Don't have emotions. That's not okay. We don't want to see them. We don't want to know about them. But so some people don't even know how to work through their own emotions. So sometimes, some therapy there is a good thing. They encourage clients to review the relationship with the deceased and to integrate the fact of the death into their lives. Because let's face it, that's how acceptance occurs, and that's something that you need to do. In helping people handle grief, counselors need to take into account ethnic and family traditions and individual differences. Counselors, if anybody's a counselor and you're listening, that's something you need to take into account. The cultures differ, so cultural practices differ, and attitudes about things differ. Ethnicities have their difference too. The whole family can even have different ways of doing things. So, again, we are all individuals, we're all unique, and that needs to be taken into account when we're dealing with grief as well as anything else. Death and bereavement across the lifespan. There is no single way of viewing death at any age. People's attitudes toward it reflect their personality and experience, as well as how close they believe they are to dying. So, again, everybody's different. And no two people are going to look at death the same way. Still, broad developmental differences apply. Again, everybody's different. Everybody has a different upbringing. Everybody has a different mindset and experiences. And all of those things are going to kind of come into play on how you look at death. As the timing of events model suggests, death probably does not mean the same thing to an 85-year-old man with excruciatingly painful arthritis who's having a heart attack, a 56-year-old woman in the height of a brilliant legal career who discovers she has breast cancer, and a 15-year-old who dies of an overdose of drugs, because these people are in different stages of their life. Older man, they said 85, older man, he's got to realize, if he's already in pain, and, as we become old, which we talked about the old, 60 to 80 is old. Our kids are going to tell us that. We might not feel like we're old when we're 60, but they're going to tell us we are. And science does too. And then older old is 80 to 100. And then the oldest old is 100 to 120. So, a person that's 85, they're an older old person. And they kind of got an idea that this is going to be coming up. A woman at the height of her career at age 56 might not think about the fact she's going to die. So, until she gets that scare. And then certainly a 15-year-old is not thinking about dying at all. They're immortal in their minds, and nothing like that's going to happen to them. So unfortunately, that's why teenagers exhibit a lot of risk-taking behavior, because they are still in that immortal stage where they think they are, but they're not. So that's why it's important for us to guide them and teach them so that they don't make stupid mistakes with their life. Typical changes in attitudes toward death across the lifespan depend both on cognitive development and on the normative or non-normative timing of the event. Because, like I say, people expect that 85-year-old man to die. People won't expect that 15-year-old to die. So the 85-year-old's death is normative. The 15-year-old's death is non-normative. So the non-normative deaths are going to be more shocking and harder to get over than a normative death would be. Childhood and adolescence. Not until sometime between the ages of 5 and 7 do most children understand that death is irreversible. That a dead person, animal, or flower cannot come to life again. And that's heartbreaking. I saw my kids go through it, and anybody who's a parent, grandparent, we all know, when they realize that death is permanent, and they're sad about it. They're heartbroken about it. Their little spirit's just crushed. And it hurts your heart to even watch them have to go through this. For little folks who are just learning about the world, that's a big shocker. That's something that's really hard for them, and so you need to be there for them to help them get through that. At about the same age, children realize two other important concepts about death. First, that it is universal. All living things die, and therefore inevitable. And second, that a dead person is non-functional. All life functions end at death. So, they might have some ideas about death, like death is just like a long sleep, and one day they might wake up. Or, they're laying there dead, they can't do anything, but they're still in there. They can still hear me talk to them and, whatever. So we have to explain to our little people, what death is all about. Just be loving and compassionate and understanding if that's something that you have to do. Ambiguous loss. A woman whose husband was in the World Trade Center at the time of the terrorist attack on September 11, 2001, did not believe he was dead until months later, when cleanup workers turned up a shard of his bone. And it's like I said about that woman, who didn't believe her husband died in Vietnam. If you don't have that proof then it's ambiguous loss. They could be dead, they might not be dead. You're not sure. Middle-aged women and men fly to Southeast Asia to search for the remains of husbands and fathers whose planes were shot down decades ago. So again, if they don't have that body, they're not 100% sure that that person is gone. A woman whose father committed suicide and who did not see him buried in a different state has recurring dreams that he is still alive. That happens when we move away from each other, and don't keep up with each other. You might check on your loved ones every now and then, once a week or so, because, if they're with friends. I have a family member who lives far away, and that's one of the things I think, well, she's got her friends, she's surrounded by her friends, so it could be that they would take care of that, and don't, know who to notify. So, we might get the memo quite late. Dealing with the death of a loved one is difficult enough under normal circumstances. But when there is no body, no clear evidence of death, it can be harder to face the finality of loss, because our brains believe what they see, hear, experience. So without us experiencing that death in some kind of tangible way, our brains have a hard time wrapping itself around that. It's like, well, maybe they're not. Maybe they're still around. I didn't see them, So this is especially true in the U.S. culture, with its media-fed tendency to deny the reality of death. We've all seen, movies and TV shows where, the person's reported dead, but then they come back later on. They're not really dead. That was somebody else's body, or, they were missing and they lost their memory or whatever, and then they suddenly come back. So, yeah, we like to believe, that is a thing here, especially in the U.S. But, that can also be a hindrance to you mourning properly. People yearn for a body, says family therapist Pauline Boss, because paradoxically, having the body enables them to let go of it. And that's true. If you see the body, you're burying the body, then it's easier to let go of that person than if there's no body for you to mourn. Viewing the body provides cognitive certainty of death, and thus enables the bereaved to begin mourning. So that funeral is an important step, or that, a memorial ceremony. I've attended a couple of those in the past few years. That's important. That lets people know, yeah, this person is gone. They've moved on, and now I have to get on with my life and move on. Boss tells of a woman whose husband was missing in the World Trade Center, who wished for just a part of him to bury, even a fingernail. And I imagine that's because she wanted to move on. She wanted to grieve him, and know for sure he was gone. Boss applies the term ambiguous loss to situations in which loss is not clearly defined and therefore is confusing and difficult to resolve. Because like I said, we want to hope. That hope springs eternal. We want to believe that they're still out there. They're not gone, and they're still out there somewhere, and someday they might come back. Ambiguous loss can be especially stressful, and waiting and wondering for clear answers can be tormenting. If the environment remains ambiguous, uncertain, and incomprehensible, Boss explains, cognition is blocked, emotions are frozen, and continued individual and family functioning is severely hampered because there's not proper grieving. They haven't accepted the loss, so they haven't grieved. It's just kind of in limbo, and that is not, a healthy thing for it to continue on forever. When a loss is uncertain, people are denied the ritual closure that a funeral provides and tend to be immobilized, unable to go on with the necessary tasks of recognizing family roles and relationships. So again, that can like I said, put you in limbo. You haven't accepted the loss yet because you don't have proof that it has happened. The loss goes on, creating physical and emotional exhaustion, and the support of friends and families may drop away. Because at first, when you say they're missing or lost or whatever, they're going to be like, oh my gosh, hopefully. But then later on, it's going to be, well, it's been X amount of time, and that's why legally in a lot of places, the time is 7 years. After a person is missing for 7 years, you can have them declared deceased, and their estate can be divided up or whatever. So that gives a finality to it, to let you know, well, it's been this long, they're probably not coming back. And that also gives you some closure to mourn that person properly. And now, just because that happens, I've known people, like I said, that have had that experience, and they still held out hope that this person is not gone, and they even lived to pass away, and it never was resolved. So that's not something that you want to carry on with forever, because you need closure to move on with your life. So that's where I'm going to leave you for today. I hope that helped you figure out maybe a little bit more about why you do what you do. My tongue today. But, please like and share this educational program so we can spread it around the world. If you want to help me out, subscribe to my YouTube channel. If you want to help me out even more, go to my Patreon page and become a patron. Thanks for watching or listening. That's all for now. Until next time.